everyone. And oh, sorry.
Yeah, we can go ahead now.
Right, thank you. Very good afternoon, everyone, and my sincere apologies for being late, but an overrun of another meeting. Oh, that's very kind of you to say so, Howard. Thank you, thank you. You must introduce me to your scriptwriter, please. Thank you. Well, a very good afternoon and welcome to everyone. First of all, apologies for absence. We have received apologies from Paul Bentley, the ICB representative. Vincent's here today. And, oh, yes, sorry, Vincent Badu is your substitute, I understand, Vincent. Thank you. Also, apologies from Martin Riley, Donna Marriott, Tracy Rouse, and also Gary Etheridge. Are there any other apologies that... Sorry? Oh, Jane Black, yes, I've just left her. Yeah, just left her up at the hospital. That's right, thank you.
Oh, I see. She's taking this time off to get over it.
That's right, you got it.
Chairman, also Neil Howlett is unfortunately unable to join us to present the Community Safety Partnership item. So with your agreement, I'm going to be twin-hatting. As I chair the Community Safety Partnership, obviously with your good grace, Chair, I will present that item in Neil's absence. So, and I suppose that's a very, very slight OSI, isn't it? I should say that I also chair the Community Safety Partnership when that item comes up as well.
So. Okay, thank you for that, Adrian. Right, the record of the meeting is the record of the meeting held on the 17th of November 2022 correct? Right, all happy that I sign it as such, thank you. There are no urgent matters, declarations of disclosable pecuniary interest and other significant interests. Are there any declarations that anybody wishes to make, please? Okay, thank you. Right. But now on to the main business of the meeting. As usual, may I ask those introducing reports to keep their introductions to a maximum of 5 minutes, please. So item 5, the Chatham Medway Safeguarding Adults Board Annual Report. We now move to this item, and that's going to be introduced by Andrew Raby, who's with us this afternoon. Very pleased to see you, Andrew. Thank you for coming.
Thank you, Chair, and thank you for the invite to present this annual report. It doesn't seem that long ago I was here talking to you about the previous one, but here we are again. It's a slightly different format, and a couple of things that you need to know immediately are this annual report relates to April 2021 to March 2022, which does seem some time ago now, but it's the way the format of the reports works. So I will also maybe give you some sort of a flavour of the things that are happening now as well, which might be helpful, particularly the area of sort of that collaborative working that we're looking to develop in relation to Medway. We also have a new strategic plan, which was launched in November 2022, and this plan and this report will relate to the previous one, which dealt with prevention, awareness and quality. I want to give you time to ask me questions. The report is slightly different in that we've had appendices now which relate to the data, because one of the things that we have to do is to actually produce to you details of all the SARS and feedback we have of activity that's taken place throughout the last 12 months. So I won't go into too much detail about that, but leave that for you to ask me questions if you wish to. So, what I really want to do, I suppose, is to just pick out some items that I feel may be of interest to you. And I'm going to jump straight to, I think you all know the board well enough and know about the role of the board. But just to touch upon that we are an independent board. I am an independent chair. I don't work for Medway Council or indeed Kent Council. So I'm here to chair a board that oversees the delivery of safeguarding in Kent and Medway. So that independence is really important, and the annual report is a reflection of the work that we've done together with the partner agencies in the last 12 months to improve and protect vulnerable adults. So it's that sort of that summary of all the different things that have happened in the last 12 months. So on the basis of the report it's a statutory requirement. It's one of the things that we have to do on an annual basis. I just want to touch upon some of the areas from it. So some of the things that we've actually done. So in terms of preventative work and things that we've done in relation to preventing issues around adult safeguarding and protecting, the first thing I'll touch upon is training. I'll wait for the laptop to... That's all right. That's all right. No, I'm impressed with the green cycle hat as well. That's a lesson to us all. Thank you. So one of the most important things that we deliver is training. The training that we deliver comes from the things that we learn from the SAR reports, the SAF report that we do, which relates to information we take from an inspection regime of where we actually contact all different agencies and ask them a series of questions that become RAG-rated. So we are understanding as best we can what's actually happened, what's been delivered, and then where we see gaps, we put on training courses. We've delivered 59 workshops in that period of time, and 683 delegates have attended those workshops. So we've covered a wide range of subjects. We also put on webinars. So for those of you that haven't been to them, the invite is there and the option to come is there. They are for anyone to attend. We hold them in the evening for that reason. So they start at 6 o'clock and they go on till 7:30. And we bring in a variety of different people to talk about safeguarding from their perspective. So it always comes from people who have a lived experience of the safeguarding process and working with agencies. So we've covered mental capacity, we've covered alcoholism, we've covered issues around the board, and we've also covered what it's like to be deaf and live in the community and work with other agencies. So that's something we're looking to build. We do that more and more. We have lots of areas lined up to actually present. The next one we're going to do is in relation to homelessness, and will be delivered by Porchlight being a homeless charity, together with East Kent dedicated nurse to homelessness, to sort of talk about some of the work they're doing. We've also done, we've had a new training provider. The contract with the training provider ends in a year and they don't want to renew the contracts. We're in the middle looking for a new approach to our training. We've done a What Safeguarding Means to Me video, which was circulated through our website. And we've done some work in relation to the multi-agency response to vulnerable missing people. One of the things that I think, and I recall this from when I was in the police, that a missing person and the work that needs to be done in relation to finding a missing person is often escalated if the person has vulnerabilities. And the board has put together some work to put forward a change in approach, that if agencies are aware of people they have who are vulnerable, that we have already set information in place to actually accelerate the work we can do to find that person and bring them to a place of safety. And that's actually been done in conjunction with all agencies and actually has been put forward and delivered by Kent Police. So that's a really good piece of work that we've actually pulled out. Turning to, let me get this right, raising awareness, some of the work we've done in relation to raising awareness. I'll pick out some of the work in relation to the Ukraine response. We put out information to people coming from Ukraine that were going to live here that was published in their language. We put in place work that actually, through the board, that we would actually support people with any safeguarding issues. And it was actually taken on from a national NHS point of view and has been shared across the country. So I'm very pleased with the work we did there. We always take part in the Safeguarding Adult Awareness Week, the National Week, through the Ancraft Trust, and we did the same this year. and did quite a lot of work in relation to that. Community engagement. One of the strands in our new strategy, and I've got to say it's always been a strand, is how we bring in the voice of people with lived experience. How do we test the processes that we're doing to make them more public? And it's one of those things you think about and you think, oh, we'll have people on a board and they come in and they tell us what they think. And having looked at it and you've seen how many of those different groups there are, what we've realised is that we don't need to actually do it ourselves. We don't need a group of people. We should be tapping into what's already there and raise that question around safeguarding. So we've spoken to the advocacy people who deliver advocacy to people who are vulnerable and need advocacy at times when they're engaging with services. And they are going to do some work for us around that interaction, develop their own groups that sits outside of the safeguarding board and delivers us that view and that interest. I touched upon the webinars. They're open to the public as well, and they're focused around what people say their experiences are. One of the exciting bits of work we're doing, which I'm really, really looking forward to seeing how this maps out, is with Health Watch. We've recently met with Health Watch to speak about how they can test some of the areas that we've highlighted that we've changed or tried to improve upon as a result of safeguarding adult reviews. So we're going to give them themes that they're going to test out with people that they come across through the Health Watch process to say whether or not our expectation in relation to those changes is being met by those that use the services. So it's a really interesting approach, and I'm looking forward to seeing how that maps out. So hopefully next year I'll be talking a little bit more to you about that. And the newsletter. We have a newsletter, we have a website, so raising awareness. 290 different organisations subscribe to our newsletter. So I'm always saying to people, please, if you have things that relate to adult safeguarding, please raise them with me. Tell us as a board, and we can actually get things on there, get messaging out there. So we've touched upon things like fraud. I touch upon fraud because fraud's an area that over this year in relation to vulnerable people has actually reduced. And that's, when you start to look at that, you start thinking, so, well, why is that? Is it a raising awareness? Is it that people are more aware that when they get a phone call and they don't know who it's from, what to do? Banks have improved their processes. So that awareness becomes so important when actually protecting people from crime and other issues. Okay, I'm talking just turn to quality now. I touched upon the self-assessment framework, so I won't go into that in any more detail. The SARS is the other area, which I'm going to touch upon in a minute, and the executive group themes covered in the last 12 months. What we try to do within our executive group is to make sure that we're highlighting and presenting themes that are relevant to Kent and Medway. So we've touched upon issues of asylum seeking. We touch upon issues of homelessness, transitional safeguarding, areas that we feel that we can actually do something about and raise more awareness. All agencies are doing this, but it's our job as a safeguarding board to highlight where we see concerns and what we can actually do in relation to those concerns. So turning to SARS, which is an important part of what we do, the safeguarding adult reviews which we carry out have without doubt increased. 2014 the Care Act was introduced and the safeguarding adult review process was introduced. Since 2016, we've seen a 600% increase in the number of SARS. A safeguarding adult review is carried out when a person who has care and need suffers abuse and neglect, and as a result of their care and support needs, they're unable to protect themselves, or services haven't maybe done as much as we feel they could have done, and we want to learn lessons from that. So why has there been an increase? Much better awareness in relation to the process is one of the areas, and it's tested through our SAF process. We get lots of people reporting in. Anyone can report in and raise a safeguarding adult review concern. It doesn't have to be anyone from a statutory agency, so we have members of the public who raise issues with us as well. And we have quite a robust system to actually defining what it is we're going to do and how we're going to do it. However, 10 years later, we feel that we need to look at our process, and the new process is being designed that will be presented in relation to how we're going to deal with them in the future. Between April the 2020 and March 2021, we had 31 new SAR applications. 17 were commissioned and 14 didn't meet the criteria. The themes from SARS that we're seeing that are emerging, these are the things that we feel are important that we see on a repetition. So self-neglect is still the top issue that actually comes up in SARS. Now, some people often say, so why does it keep coming up? If you're doing training in relation to self-neglect, if you're raising awareness in relation to it, why do we see more SARS being raised? And it's partly because people are aware of it. Agencies are aware that actually what it is and what to do about it. There's a procedure, there's a process, and actually it's raised through the adult social care and other agencies to deal with it. So sometimes increases are not a negative, they're a realism in relation to actually that raised awareness. Of course we want to reduce it, but I always say with volume issues such as this, we should be looking at reducing the repeat and making sure that the repeats aren't occurring and making sure the processes are in place to prevent that. Cuckooing is another area that I've got to say is you know, I look at these things and it causes me some concern. Now, cuckooing is often attributed to sort of drug dealing and issues such as that. But what we're seeing is that vulnerability is becoming a target of cuckooing. So a person with a learning disability who might be living independently is often targeted, and what you find is someone actually arrives and then presents themselves as their carer. And all the time they're taking money from them through their allowances being given to them, they're living in their house, and they're managing them through the process, but calling themselves a carer. We've seen this turn up in 2 or 3 SARS already, and it's a worry. It's interesting because you have shared lives in Medway, and shared lives, and I was talking to the person running shared lives a little while ago, but 40% of the people that come into shared lives within 4 years live independently in Medway, which is fantastic, is what should be happening, and I think is a feather in the cap of Medway. It doesn't happen in many other places. But with that comes a responsibility, I think, to other agencies to protect those people living in the community, to understand their needs. I have a raising concern at the moment that issues of crime reported on behalf of a person with a learning disability, and you can do that through the hate crime legislation, aren't being picked up and recorded by police. So you don't get the same service if you have a vulnerability in terms of crime, recording and investigation as you might do had you not been. And I'll give you a great example. Matt Hancock gets pushed on the tube and the bloke's charged the next day. If you have a learning disability, the difference is you may not actually even get that recorded as a crime. And it's often because, one, you don't know the process, but two, if you report it to another person, another professional, they may not be aware that they can report third party that crime and actually have that reported and investigated in the same way. So it's an area I'm sort of opening up some dialect and conversation about, and I've asked, and interestingly, because I spoke about this to Kent Police yesterday, there is data that they have which shows their processes around that investigation around vulnerability, and it's an area I'm quite interested to explore. Alcohol dependency has grown. I'm going to go through these quickly now because I'm starting to ramble. Mental health, hospital discharge, professional curiosity, collaboration, mental capacity, and sadly suicide has seen an increase during this period of time. The last thing I just want to touch upon, I suppose, is in relation to learning. And what we do in relation to the recommendations. So the learning that we're looking to cover that comes across from this is making safeguarding personal, identifying and responding to hoarding, awareness of the Kent Medway safeguarding policies and procedures, working with individuals dependent upon alcohol, suicide prevention, safe discharge from hospitals, annual health checks for people with learning disabilities, and carers assessments are all areas that we feel come out on a regular basis from our SAF and from our SAR process that allow us to actually say, these are the areas that we need to be focused upon. I'll pause there and allow any questions that anyone might have. Thank you.
Thank you very much, Andrew. very informative and well-presented report. Any members, please? I see that Councillor Tranter, followed by Councillor Doe, then Councillor Potter, Councillor Galvin, and then Councillor Maple.
It's a full house.
I hope you can remember which one it is.
Andrew, thank you very much for the report. And the detailed report itself is also very impressive. There's a huge amount of information in there. Just one area I'd like to touch on, just to seek, and it's a difficult area, and just to seek some reassurances and understanding. And I'll give you an example. I'm a member of the fire service, and of course that involved in a different kind of safeguarding. And equally, we have all sorts of procedures and so on, which are probably in some ways parallel to the kind of work that you're doing, which is all very well until somebody misses something, such as cladding, and then there's a disaster, and then we all focus on that issue. And then in the ensuing reports, we discover that there are people who had actually been waving a flag of concern, but they were people, probably a little bit like your example, who don't necessarily get heard. What I'd like to know is, when we get outside of the realms of the professionals, who I've no doubt whatsoever today are very well briefed and understanding on safeguarding issues and are looking out for it in their day-to-day work, and indeed running all sorts of things within organisations, there are very large numbers of people within our populations who will not be in touch very often and will not necessarily be well informed or recognise safeguarding issues, and they could be very valuable to us if we... Now, it is a very difficult question, I know. What sort of work is going on to try and raise awareness amongst the entire population in very simplistic terms about the problems and the issues of safeguarding, so that we can potentially capture more cases that require attention than we consequently that we currently have? I hope you understand what I'm saying with that. Thank you.
We use a strapline, and noticing isn't nosiness. And the reason we use that, because it's actually clear to anyone and any member of the public that actually everyone has a responsibility and can play their part in protecting vulnerable people. Jackie and Leanne won't be keen to hear this, but there's an increase in the number of reports coming in anyway. So this year has seen an increase in relation to Section 42 referrals that come into the local authority. That shows that people are aware of that. We measure through our annual review lots of different agencies and voluntary groups that actually, to understand, do they know what safeguarding is? And the other thing is, there is a requirement for them to train all their staff, all their volunteers, to level 1 and a level 2 level of safeguarding. Now, I'm a trustee of a small charity, and one of the things that we do is we make sure that all the people who engage with our group of attendees, our group of attendees have dementia, and so they're carers, and they are often vulnerable. But all of our volunteers that work with them are trained in safeguarding to ensure they know the signs. And what I try and say to people is I encourage people to use your natural instinct. When something's wrong, it probably is, and actually tell someone about it. And a lot of the processes that local authority in Medway have allow people to make contact, to report their concerns, and actually get something done about it. So there's a very open, transparent process. On our website, we make sure that everyone knows how to actually make contact and report issues. But we're not sitting on our hands on this, because I think you're absolutely right to raise it. And I think one of the things we do need to do is to make people more aware and maybe empower people and communities to look after their own residents and families, to be more aware and know what to do when they need to report something. So it's a bit what you're talking about is bottom up, and I think you're absolutely right to raise that. We need to make sure people know how to report, how to respond. The news is that people do generally, but there will always be things that will slip through. And I think it's the vulnerability, the groups from vulnerable groups, that I want to ensure that they know that those services are there for them as well.
Thank you. I'll leave it there, Chairman, but I think my main point is really about outside of the normal contacts, and it is the ordinary people who just need to have some kind of awareness of how to deal with these things.
Yeah.
But I get your point. I don't want to labour it any further.
It's a
but
filter
thank you.
down, isn't it? It's making sure the more people that are aware of it, the more people, the amount of voluntary groups that work within Medway is huge, and making sure that they are getting that message out is really important.
Thank you.
Sorry, I think, Jackie, you would like to come in on this and perhaps give some support. Yeah, thank you.
Thank you. Yeah, I just wanted to give a bit of reassurance. So Andrew mentioned about the increase. So we've had a 21% increase in Medway Council alone in the last year. And we're seeing that come from a wide range. So it is coming from partners and agencies in VCS, but we do get it directly from residents. So neighbours will be concerned, raise concerns. We have elected members come to us when they meet people and raise concerns. So it's quite a broad brush that we're seeing. Sometimes people come to us because they think it's a safeguarding concern, and actually it isn't. It's more about a needs assessment. So people are flagging it. There is still more work to do. I won't deny that. But it's definitely becoming more recognisable, and I think in the same way from children's services where safeguarding is, everyone thinks that's their business and safeguarding children, we're starting to see that change in adults as well.
Thank you, Jackie. Now, what I propose to do now, because got a fair amount to do in our agenda this afternoon, but next to for question is Councillor Doe, but perhaps if you, Howard, can put your points, then followed by Martin, and then we can then turn to Andrew to answer that, and then afterwards we'll pick up with Adrian and Vince, if we may. Thank you.
Okay. I think I just wanted to make one comment and one question, really. I think the first thing is that on your I'm very pleased that you're looking at housing, the homelessness, because I think homelessness is very, very difficult. I mean, the council is now working with the government for some time to try to produce a really good homelessness service that does reach into those people. And we still have problems. I mean, for example, when we had the bad weather protocol in place, severe weather protocol in place, we had, I think, 30 people who qualified, or nearly half of them, having been approached, having been persuaded, still preferred to remain outside, which is rather sad. I mean, you obviously got to leave freedom of choice. So that is one thing. But obviously, I think that actually, I don't know whether you've been to him yet on this particular subject, but Mark Brethwick of the council has got an awful lot of knowledge about the way in which we're expanding the homelessness service, and I think it would be something you ought to actually touch base with him on. It could be very helpful to you. The second thing which concerns me really, and I know it concerns a lot of people around this table, is we had an inquiry the other day from the Times Educational Supplement, and from that we were asked how many people are being dumped in Medway, as it were, if I can put it that way, and I'll tell you why I say dumped, it's not an answer, is there are people who've been taken by other areas because accommodation is cheaper in Medway. They have then been placed in Medway frankly to save money. Now, things that worry me about that, actually, is first of all that obviously it's very cruel in some instances when people have got their own networks. However they have their own networks in their own place, and then they're simply being pushed here on the basis of cost. And secondly, that on the basis of cost, although we do what we try to do to educate and to look after the children, etc., and indeed are doing very well, but actually it's causing massive overspends, and they're not unsustainable overspends. And it's not profligacy or anything like that. I mean, if I give you set the scale of it, we found that in 3 years we've had 1,227 either individuals or families that have actually been transported into Medway by a variety of councils. And that seems to me to be, although the government says it doesn't like the practice, it doesn't seem to have done an awful lot about it. And I'm very concerned about it, because I think that ultimately it makes budget making, not only for us, but I mean for the NHS, for example. It's really putting an extra burden on it that it ought not to be bearing. And I think that's a very serious and unsustainable thing, which I think that I don't know whether the NHS is as concerned about this or realises the scale of it, because I certainly didn't realise it was quite on that scale. And I think it's something which I've asked for the senior areas in the managers in the council have this discussed out, so we can get an across the board look at how much of this is going on, the social consequences of it and the financial consequences of it. And then I think we need to take this up with our members of parliament and any other channels we've got into government, because it just is not working.
Yeah, thank you, Chair. I wanted to comment on the reporting process. So I've had experience both as an elected member and with regard to a family issue with safeguarding. The family issue was not in Medway. And I'm very aware that when you are reporting a safeguarding issue, that's because something unpleasant has happened, something has gone wrong. And ideally, you don't want to have to tell that story too many times. It's likely to have happened to someone you know, or you were close to it in many cases. So it is a very, very sensitive matter. We're very good at this with regard to children and trying to minimise the number of times we have to have that sort of engagement with a child over a safeguarding issue. With regard to adults, are we as integrated as we could be? Is there a model of best practice here? And if I think about the ongoing work we do with children, we have the Signs of Safety model here in Medway, which is, I think, very sensitive to that. So with the approach that we have with adult safeguarding, are we as integrated as we could be? And do we follow a best practice model with regard to that? Thank you.
Sorry, Jackie's signalled that this is more to do, obviously, with procedure and process rather than oversight, is what I deliver. Turning to Councillor Etheridge or Howard, sorry. Howard, sorry. Howard Doe, sorry. I mean, what you raise is a political issue. My role is to oversee the delivery of safeguarding for anyone that has a vulnerability. And so I don't really look at that issue of where that person comes from. I focus upon ensuring that when somebody needs support and has care and needs support, that is delivered. So your point is important, but it's political, and I'm not political. I'm not trying to sidestep that, but it would be wrong of me to sort of question or comment in relation to that. The other comment in relation to the procedure, the only thing I would say to this, because Jackie will come in and give you the whole thing, way things work, but we look at this and we talk about this. And if I could just, I'm pleased you brought this point up, because one of the things that I'm looking to do, and particularly in Medway, is bring together the different boards to say, look, we all do certain things. So the CSP will be focused on areas of practice, we'll have action plans. The Children's Partnership will do the same. And even the Health and Wellbeing Board at Medway, to a certain extent, is the same. And the Safeguarding Adult Board is also. So we need to start looking at what commonality we have to actually tackle commonality across all of the different boards to be more effective. And I think one of the exciting things that you can do in Medway, because Medway is unitary, is you can bring those issues together far more easily. There's not all the districts that Kent would have. So I'm meeting with the leads in relation to each of those groups to talk about this and say, what can we do better collectively than we're doing independently and individually, and see whether or not we can pick a couple of things over a period of a year and say, let's actually tackle these two issues and let's see how far we can get when we're all tackling it together. So an example that springs to mind for me is always domestic abuse, because it affects and impacts upon so many different people. And I think once we've had that and we start talking about that commonality and that collective approach, we could see some real good inroads in relation to this. So thank you for raising it. I'll pass you over to Jack here, who will tell you the details of how things are reported.
Lovely, thank you. So I'll just touch on Councillor Doe's comment, if somebody's placed by another local authority. If somebody's placed in Medway and have care and support needs, it's the responsibility of that other local authority to continue to fund that. However, if there is a safeguarding raised while they're living in Medway, it's Medway Council's responsibility to lead on it. So we liaise and work with that other local authority, but we are we hold the statutory responsibility. So there are implications from that perspective. With regard to Councillor Potter's query about is it as integrated as it could be in the same way as colleagues in children's, I think adult social care has a way to go. We do work closely with partners, but I think do we get everybody around the table that we need to? Not necessarily all the time. So that's something that we are working on, and definitely something that needs to be considered as part of the CQC assurance review. And Leanne's actually leading at the moment on safeguarding in adult social care in Medway and how we improve things. With regard to signs of safety for children's, for safeguarding in adults is actually making safeguarding personal is the process. That's a national process. With regards to care and support needs, then we have what we call 3 conversations, and that's a strengths-based approach. But for safeguarding specifically, it's making safeguarding personal.
Thank you, Jackie. Can I now turn to Adrian, followed by Vince, and if you can put your points together, please, that would be appreciated.
Well, just got a couple of comments first and then a bit more of a question. Well, thank Andrew for a very good report, and a couple of things from the report that really stood out to me was the way you've been very proactive. The response to the Ukrainian refugees I thought was very good, very positive, and well done. The other thing that caught my eye was the monitoring of safeguarding adult reviews. The 2 comments there about ensuring that actions are actually actioned upon, I think was very, very good. And I also like the idea of actually, if you find something wrong, not waiting to the final report, but trying to get things fixed on the way. I think those are really, really good points. Another just a little thing, I loved your easy-to-read action plan. I thought that's something perhaps we as the council could learn from with some of our documentation. I think we have now got a duty to make our documentation more accessible. Certainly this sort of thing on our website would have been much. So I think you've got some good examples. Now to my question, one of the things that we're doing, we've formed that a combating drugs partnership, which James there is leading on, and wearing my other hat as chair of the community safety partnerships have got a role to play in that. One of the issues that is becoming very clear now is that the nature of the criminal gangs that are operating the county lines has changed quite significantly over the last probably 3-4 years. They are, since the Albanians have muscled into actually running the thing from the top, the whole thing has got a lot more vicious. So you talked about cuckooing, which we have had incidences in Medway where vulnerable adults have had their premises taken over. But there's an issue actually with the people, the couriers who take the drugs. I mean, people talk of these people as dealers. They're not dealers, they're couriers. A dealer implies that the person has some negotiating ability over price or whatever. These are couriers, and it's becoming very obvious that they are latching onto very vulnerable people. And whilst only a handful of them that I've heard about have been children, the vast majority have been young adults, and very vulnerable young adults who've probably got mental ages lower than most children. And there's a difficulty in this of how you can apportionate things, of how much a victim this person is and how much criminality and the perpetrator they are, there's still balance, but given they're vulnerable people. So is there a stream of work that we could work with you as the Community Safety Partnership and the Combating Drugs Partnership of how we can get some sort of protocol of how we deal with these young people who are, yes, they are committing a crime, there's no doubt about it, but they're also very vulnerable. So I think some sort of protocol of how we can make sure that they're dealt with fairly, and which, you know, bears in what you were talking about with the pushing incident. You know, often because these people are primarily seen as criminals, their vulnerability side is perhaps not given the proper measure that it should be given.
I mean, you
Thank you, Adrian. Sorry, can I go to Vince first, Andrew, and then perhaps he can you can put the 2 points together. Thank you.
Thanks very much, and apologies for my slight delay in coming here. And can I open my remarks today by recognising and sending condolences to the family of Helen Jones, who was a former member of this committee in her officer role as Assistant Director. Our thoughts were with all of her family, friends and Wiltshire colleagues, as well as colleagues here. She'll be missed and was a great professional. So it's a sad time for that. Thank you very much for your presentation. I was able to put some of my questions that I would have put to you today at the CSP. So I won't go through those again. But your answers, as one or two other colleagues have said, particularly around the unique situation with Ukraine, I think is to be welcomed. I've got two questions, really. One is around whether there is a gathering of the independent chairs across England and Wales, or the UK, just to see if there's any national trends and what can we do about that. And it may well be that there's nothing we can do about it, but we need to know what the trend is to be aware. And then secondly, we are very lucky that we're in a situation where none of the partners could be perceived at this point in time to be a risk. That's not necessarily the case elsewhere in the country. If you live in London, the police may be seen as a risk. If you live in some parts of England, the fire service could be seen as a risk, often because of individuals within those organisations acting inappropriately, acting illegally, but it's around that kind of sphere of trust that you get with professionals. So actually, in those health and wellbeing boards and other settings, part of the conversations they'll be having is actually how do we regain the trust of the public with the system, because people, individuals, not organisations, but in the eyes of the public, organisations have let the public down. I say in some cases they've broken the law and they'll go through the due process of the justice system. So I just wondered, and that's by luck, you know, it's luck that we don't have those individuals in Kent Police, Kent Fire and Rescue, Medway Council, KCC, etc. So I wondered whether, as part of that, whether there's been any discussions around actually how does the system, and in particular the part of the system which is there to make sure the system is working effectively, because I think that's a key part of the board, and the independent nature of it. How do we make sure that moving forward that there are lessons learnt from those sometimes individual isolated situations, which could lead to a situation in the worst case of actually people not reporting stuff through whatever method because they lose confidence in the system. I say often because of one individual or one part of the system. I say it's just by chance that we don't have that problem here in Kent. It could be Kent today as it has been London and elsewhere yesterday. Thanks very much.
Andrew, please.
Turning to the first point, what we're talking about is exploitation. So people are being exploited due to their vulnerability for the gains of others. And this is a national crisis, in my view. This is happening more and more throughout the country. And I think what's important, and it's often the case, and it actually cuts across the two questions actually, is that there has to be a development of faith in reporting, and there has to be development and faith in understanding that something will be done. But coupled with that comes an awareness of those organisations. So it's something actually that I've spoke about in a different forum, but speaking to someone who has a learning disability is often overlooked, and there are often associated, what's the word I'm looking for? People make judgments that actually people understand more than they're actually saying, because they've learned to actually communicate in a way that works backwards and forwards, but their understanding doesn't always work. So capacity and mental capacity becomes an issue. So can somebody make a decision or say something where their capacity says to you that making unwise decisions? And those are sort of areas that we've touched upon in learning and training to ensure that not only do the professionals, such as social workers, who have a good understanding of mental capacity, but I've been pushing for frontline police officers to have an understanding of what capacity looks like, so they can make dynamic risk assessments about someone's capacity. And the law actually supports that. So raising awareness of what can be done with a person who is in a vulnerable situation. I think it's fair to say that all agencies are very alive to this and do understand the risks. But it is, I think you're absolutely right, there's a move across away from it being children to being vulnerable adults. And I think, and this is my job really, is to say to agencies, what are you doing about it? You know, I used to come up with the answers. I now actually say, so what are you doing about it? And challenge and say, you need to be doing something, because we're seeing this as a growing trend and a growing concern, and actually showing where the evidence is that backs that up. So I think it's a really important one. I would absolutely welcome anything. I think we need to start talking together. We need to be a bit more joined up, and I think Medway's the place we could do this really well. You know, I know CSP work really well. I used to be head of partnerships and communities, and I was on the CSP, so I know it pretty well. So, and I know Medway very well as well. You know, I've lived here, worked here. I know it extremely well. So I think together we could do some really interesting work between the CSP and the SAB, and together with Children's Partnerships. So yes, we are planning to meet and talk anyway. So let's put that on the agenda as well. So 2 points. Yes, there is a national group. There's national SAB chairs, but there's also regional as well, and I'm the chair of the regional South East Region Group. And it's interesting, the commonality. You're absolutely right. There is, we're very fortunate with the national chairs at the moment. There's a guy called Michael Preston Shute, who's a professor of social work, who really does take this. He's raised the level of what we do on a national level. So, for instance, a couple of things. We now collate all safeguarding adult reviews on a national basis in the SAR library. So what we can do then is we can actually pick out themes, and we can search against those themes to say what have other people done around safeguarding or for instance cuckooing, for instance self-neglect. And we can see what other practices out there, so we can actually jump into doing that practice a bit more quickly. There is, we also raise things at a national level. We're trying to sort of, I don't think we're there yet, but as a national body, we like to challenge on a national basis. So if we see a theme emerging that is causing us concern on a national basis, we'll raise it at a level. Ministry of Justice at the moment is our target, because we're finding that the Ministry of Justice and their responsibilities in safeguarding are areas that we have concerns. So we're trying to meet more regularly with them. We meet with the Home Office around asylum seekers because of the concerns raised within our boards in Kent and across the whole South East and the UK. So it works well. It's a sort of improving position. But I can certainly, I certainly say to anyone, information like that, if you're ever interested to know, well, what is happening on a national basis? Is there stuff that's going on? Please contact me. This is what I'm here to do. As I represent you all, and you can ask me questions as well of some of those issues. So come back to me if there's other things that arise. Now, the other point, what was the other point was, you're absolutely right. It's one of those public confidence issues. How do you ensure that people still come and report issues and seek help when they have a lack of confidence in the organisation they're reporting it to? I'm actually the SAB chair in Bexley as well. So although it's on the border of London, It's the Metropolitan Police, and they have a huge issue to tackle, and there's a lot of talk about how that might be done. You are right, we are fortunate in Medway and Kent in relation to our other services, but you're also right that it only happens to be, it'll only be tomorrow and suddenly that's all over the news, and that's the local authority. So it's about being aware. It's about making sure that actually you're always ensuring that you're testing the processes. That's what the SAR process is about. The Safeguard and Out Review is about saying when things don't work, actually let's have a look at them, but let's be transparent. So if we look at something and we say we're going to do this for learning, people often say to me, well, should we really publish this? And I say, yes, we should. We should publish everything, because if you start not publishing when things aren't going right, then you're creating a problem of a lack of trust. So we publish all our reports, unless there's a person that's going to be affected individually, and that might, out that information about that individual and cause their life to be difficult, we publish, because we want to be questioned. And organisations, and I've got to say, agencies are really, really good in the public sector of self-analysis and saying, what are we doing and how can we do it better? And sharing that information and making sure that we improve as a result. Thanks. Thank you.
Thank you, Andrew, and thank you, members. Thank you, Andrew, for a very well presented report and for answering all those questions. I'm now going to turn to Councillor Howard Doe, please, to make the recommendations. Thank you.
Sorry, thank you. Can I just ask that the report be noted and that we do note the comments that have been made upon it this afternoon?
Are we agreed? Yes, thank you very much. Thank you. Right, we now turn to item 6 on the agenda, Community Safety Partnership Plan 2020-2024 and the refreshed Action Plan 2023-24. In the absence of Neil Howlett, we have agreed that Councillor Adrian Galvin will present this paper. Thank you, Adrian.
Thank you, David.
And you've only got 5 minutes.
Okay. You've all had a chance to read the report. So it's just a few things I'd just like to highlight for comment. One, which I'm particularly proud of, that we've now got in Medway, is the multi-agency Medway task force, which brings together council services, DWP, Kent Fire and Rescue, Health, police, all together. And they have been a really good asset for us here in Medway, and they've been doing a lot of good work. And one of the things they've been particularly good at is levering in Home Office Safer Streets funding for Medway. We've had nearly £500,000 worth of funding levered in through the PPC, and a lot of that's been used to make our public spaces feel safer, because one of the problems we have with, particularly with trying to reduce violence against women and girls, is that a lot of women and girls don't feel confident when they're out, particularly at night, and a lot of work's been gone into making sure we improving lighting, simple things like improving lighting, or where you have got lighting, where there's bushes and trees obscuring the lights. They've worked very, very closely with the council's green spaces and got it cut back. They've also worked with our waste teams in getting rid of fly tipping and all these things that make a place not feel and look so safe. One of the other things that they've been working on is the Safe Places scheme, which provides stickers on premises which are willing to take people who feel vulnerable for some reason and offer them a safe haven. That's started off in Rochester, has now rolled out across both Chatham and Gillingham. Another thing that vulnerable group that the task force and the CIPI have done work with is some of the sex workers who often, again, get treated often as criminals, but they're often very vulnerable people. And there's been some really good sessions with those, which has done a lot of good work. Another thing that the CSP and the task force has taken on together is the Safety in Action days, which had a brilliant session in Chatham Historic Dockyard last year. We talk about you know, the last group of year of primary school before they go up to secondary school. They're given this induction into what things they're likely to come across as they move up into the big school and also out into the wider world. During the pandemic, those sessions were done virtually. In fact, the lady who worked with the task force actually got an award for the work was done of putting that on the line. So that's a really good thing. The other thing we've been doing is we've been for the last 3 years now, we've been providing mental health counselling support for youngsters who fall well below the CAMS threshold but still have got behavioural issues. We've been funding that, and that is beginning to show some really good results. We funded that now for 3 years, and that's beginning to show some really good results. Moving over to the probation service, another new facility we've had in Medway is the CFO Activity Hub, which is in the old Co-op Bank at the Pentagon. They're doing some really good engagement work with clients. And one which really impressed me, they formed a training group for ladies who'd like to get into the construction and painting and decorating. They formed this group, and wearing another hat, and Howard would be pleased to hear this, MDC got this group of ladies in to paint one of our offices out in the guardhouse down the road. They made a brilliant job of it, I must say. I was in there earlier today, but I met up with them a couple of weeks ago because when I was in there, they come back for us a little bit of a photo opportunity, and I got talking to a couple of these ladies, and one of them said she'd brought along a support worker from Open Road. So I thought that told a little story, doesn't it? That somebody who's obviously had addiction problems, they're on the mend, they're now able to start looking at training for future work. So I was really impressed with that. So any of you as organisations would like a small painting job done, we'll very happily put you in contact with the CFO in the group, because they, as I say, they really did a good job. Well, those are just the sort of things I highlighted. If people have got any other questions, I'll only be too happy to try and answer it. But I would say I'm the chairman of it. I'm not one of the professionals who actually does the work on the ground. So.
Thank you very much. Any member, please. Yeah. Yes, Leanne, please.
Thank you, Councillor Goulven. One of the things that's really impressed me around the community safeguarding partnership is the increased work around the prevent agenda. And you'll know that government had an announcement yesterday around that whole prevent agenda, and I think Medway is well placed around that. So just well done, really.
Yes, I mean, prevent is one of the standing items we have on our CSP meetings, because it is so important. We have got quite strong evidence of albeit a very, very small group, but there is radicalisation here in Medway. And it's one thing I've always felt has been wonderful about Medway, is we've had fantastic inter-community relationships over many, many years. And I've always put that down to Medway being a garrison town, sitting in an example of that. So people from all cultures have come back, but we must never ever be complacent. You know, we have had some issues in local schools over the last few months that have been quite disturbing, where inter-community relationships have not been as good as they could have been. And I've got to say that our youth service team went into that and did a very good job. I can't praise them enough. So it wasn't so much a community safety issue that had to be dealt with at that level, but our youth services team dealt with it in a very professional way. And I have to say, having sat in on one of those meetings, they probably dealt with it in a far more professional way than some of the school teachers who should have been dealing with it in the first place. That's not a criticism of the school, but as such. But I think our youth team were outstanding in that situation. But you're absolutely right. Yeah, prevent is still a very, very important issue for us, and you know, something we've really got to keep an eye on.
Thank you, Adrian. On the Prevent programme, if you don't mind, I'll just go back to when Health and Wellbeing Boards were first created. I chaired the first of Medway's Health and Wellbeing Boards, and the first vice chairman was a gentleman called Dr. Peter Green. And Peter's message was very clear to us: prevention is better than a cure. And I like to feel that all throughout on the work that we do on health and well-being is that we need to be very mindful of prevention is better than the cure. So thank you for that, Adrian. You wanted to come in, Stuart, please?
Yeah, just very briefly, Chair. I don't want to spoil the speed with which we've now picked up in the meeting, but I think several members have seen the report previously. Is probably why we're not needing to leap in with lots of questions at this stage. But I did just want to add that certainly in my experience in recent months, we've turned quite a corner in the sense of, or at least for me, I want to congratulate both the police and our own officers for being very responsive to any issues locally, which there are always issues. We'll never get to the end of this road, but I think that's really, really helpful and important that as a member, we feel that locally when we have things to do with community safety that we pick up that they are dealt with. And I just wanted to report back that in my experience they being incredibly helpful, even though there's a long way to go in some areas, but it's really good news. So I think us not asking a lot of questions is probably a good sign.
Thank you, Stuart.
Thank you, Stuart. That's good to hear, and I'll make sure that gets passed back to the appropriate people, because I know who you're talking about. Thank you.
Thank you. James, you wanted to come in, please?
Again, very briefly, Chair, and just it's a comment really just thanks to the CSP in relation to the additional support that was put in place to hard target the car park and the top of the Pentagon Centre, because we haven't had any further incidences since the that framework and fencing has been put in place. So just thanks again to the CSP.
Well, thanks for that, James. I think that was a good example of multi-agency working, because I sat in the group, and we had a mixture of academics, and I believe one of the gentlemen from the University, Christchurch University, was one of the world's leading experts on suicide. And then there was myself as more of a nuts and bolts person, so well, how can we get the thing screened off? And our colleagues who run the Pentagon Centre actually then organised the actual physical barrier. So I thought that was a good example of, if you sit round the table, have a mixture of very well qualified experts, lay people, and people who are willing to do things, you can make a change. And that was just a good example of, of how it works, because you can make it work.
Well, thank you. There being no other member, may I turn now to our Vice Chairman, please?
Yes, I'd like to move the recommendations, which need slight amendment in 9, with section 9, that the board notes the strategic assessment 2022, and also the board notes that as a policy framework document, the Community Safety Plan 2020 to 2024 was adopted by full council on 16th of July 2020, and I think this board supports both the tenor of both those documents.
Thank you. Are we agreed? Thank you. Right. Moving on now, please, to item 7, the Kent and Medway Interim Integrated Care Strategy, which you'll find on pages 151 to 222. And this is going to be presented by Dr. David Whiting, please, our Deputy Director of Public Health. Thank you, David.
Great, thank you. Medway Council is part of the Kent and Medway Integrated Care Partnership, along with Kent County Council and the NHS ICB. And as part of the Health and Social Care Act 2022, all ICPs in the country were required to produce, or are required to produce, an integrated care strategy. The guidance for that didn't come out until late in July, and we needed to produce a strategy by December. The guidance had two very important things that we need to take note of. One is that they acknowledged and recognized the importance of good engagement in developing strategies, but then also recognized that the time allowed, or the time requirement to deliver it by December, meant that it would be difficult to do extensive engagement. And the second important thing to note is that it's an interim strategy. So this is an initial strategy. We're going to then engage on the strategy, and then engage throughout this year. There'll be more guidance that will be produced in June, and then we're going to update the strategy or produce an updated version of the strategy in autumn of this year. The integrated care strategy has been signed off by the three key organisations. So it went to Medway Council's Cabinet in December last year. It also went through overview and scrutiny before it went to Cabinet. The sequencing of the meetings meant it wasn't possible to bring it to the Health and Wellbeing Board before it went through to Cabinet. In addition to, just a thing to note, in addition to the integrated care strategy, we also have Medway's joint local health and wellbeing strategy refresh happening through this year. And we're working very closely with, I'm linked into both strategies, the development of both strategies, and we're making sure that both strategies are coordinated and not going to trip each other up or contradict each other. So there's going to be good coordination there. I think that's probably just all I want to say for now. Unless we have Vincent here, I don't know if you want to say a few words or if we just carry on.
Thanks very much, David. And I think you've covered it in essence. The only thing that I would add is that, of course, in the strategy which sets out a framework in terms of our ambitions and aspirations for delivering integrated care across Kent and Medway, there are 6 shared outcomes. And we are currently in the phase where we're picking up on that opportunity to do more consultation and engagement with stakeholders across the system. So there's work going on with the Medway and Swale Health and Care Partnership to ensure that we can really start to work at a place level and really start to think at a granular level around what are the needs of the population in Medway, but also how we work together with other partners in the local system to prioritise the strategy and to identify the things that we want to take forward. So again, as David said, working really closely with the public health team in Medway Council to ensure that actually we get that balance right and it reflects the needs of the population across Medway and recognise that that may be different to other parts of Kent and Medway, and that's absolutely fine because we want to make sure that this is relevant to the needs of the local population. So I think that link to the local health and wellbeing plan is really important, and there is flexibility here for local areas and places to make sure that they prioritise what is relevant and important for their population. So again, we will work closely together to do that and to ensure that actually we can update local stakeholders and also engage local stakeholders, I should say, particularly local communities, because we all know that some of the challenges around health and well-being need to be driven by things that local people can do for themselves, particularly with that focus on prevention. And I think that's the real kind of tenets of our strategy, is to have a much stronger focus on prevention and the wider determinants of health, because we really recognise that in the longer term, if we're to address the significant demand for secondary healthcare services, we need to be working much further downstream to stop people's health status deteriorating, and that's why we've predicated our strategy on that basis. So I just I'll stop there really. I think it is interim. We're working together to iterate it further, and all comments and feedback are really valued to help us get this right.
Thank you, Vincent. Right, I'll start off with Adrian, then Howard, then Vince, please.
Well, from a personal point of view, I've got to say I've been quite impressed by the openness and engagement, because I've got to be honest with you, I have had quite a run-in on the property side, which is, I've stood up in this very room a few months ago and was very highly critical of the property side of the NHS. But I was still invited to join the ICP Estates Forum, which I hope I've been able to put a positive thing. And I think we can all work together, because if we all work together on the basis that what we're here for is to get better facilities for Medway people, I'm sure by all working together, and I think you can guess what I'm talking about, we can get a good result. But just one example I can give from the ICP Estates Forum was a good result. The first meeting I attended, one of the items that was flagged up, that our public health team here in Medway had said there was a need for an audiological testing facility in Medway for babies. Apparently we have a problem with a lot of young babies with hearing problems. That was put on the agenda. There was a discussion about where it could be. At the last meeting, they found a home for it. There's a budget for it. And I was really impressed that, so it's gone from being a request from something that was flagged up by public health to actually, we're nearly there. There's £30,000 been found in the budget to equip this room out. So I thought that was a really good example of how things can be done quickly if we've all got the willingness to do it. So I'm sure if that's an example, our other little local difficulty we can get over as well and get that sorted out.
Yeah.
Sorry, how would you like to come in, and then we'll ask David to cover both of you, if I may, please.
Okay, fine. What really concerns me actually is, first of all, I very much support this method of working together. I think it's absolutely vital, but it's got to be, I think, still to be embedded in the grain of every person that works for any of our services, because without it, what we do is we spend a long time negotiating between us, as it were, on matters, without actually often focusing on the overall strategic goal, because it hurts us, we say, more than it hurts you, or the other way around. And I think that's very deplorable. I'll give you an example of that, and it's not all created by us, but one of the things which I know that you, Chairman, are very rightly concerned about is this present desire of the government, the desire which we all share, that those who don't need to be in hospital need to be discharged from hospital. And it's equally encouraging that they're then put into care situations which are appropriate. Where the worry comes in is that if the NHS, obviously from its budgets, can't afford to go on supporting those placements indefinitely, and when they come over to us, we actually have are then, as a council, we're then having to take those placements on. Now, often those placements, because they have to be made in a hurry, inevitably, are at much higher rates than that we can afford on an ongoing basis that lasts more than the 6 weeks or 3 months or whatever that's decided after that the NHS will pick up that bill. And that, frankly, is a way to break the system completely. And, you know, it is really something which I think needs to be tackled jointly. We need to think beyond how do we get these people out of hospital. I mean, I know it's typical of all governments, frankly. It's not a political point. It's a thing that we've got a problem, so you deal with that problem, and then you just create 3 or 4 problems down the line. And I think what we've got to do is to sort of see that through and actually work out, but really, a way which is sustainable. And I think that's the word I think underpins all of this work, it seems to me, is are the solutions, first of all, good, but secondly, are they sustainable? Because if they're not, then all we're doing is making life harder for the others, in the sense that there is only so much finance going around, and if it isn't spent wisely, because it's been spent at inflated levels, for example, then you've got a real problem. So I just think that's something that we will have to have a look at. But it is something which actually is not something that, you know, when we act in this way, the market actually is you know, beginning to creak anyway, because you know, it's just generally unstable. And I think one of the things that we've got now to look at in our integrated care package is how to make the whole of the market sustainable. It's got to be, that doesn't only mean the partners that are actually responsible for getting the service, but actually the people who can afford to deliver it, the third parties. And we've just got to get that, you know, we've got to bring them to the table and talk this thing through, because somewhere along the line, the system will collapse if we don't.
David, would you like to pick those points up, please?
Okay. Yes. So I think really both points reflect the importance of us working together in this new way and what we can achieve. I think this new approach with the integrated care system and the integrated care partnership provides us opportunities that we haven't really had in the past to address issues such as you've just been describing. We have 6 core outcomes identified in the strategy, and we'll be working together as a system to deliver along those outcomes.
Vince, please.
Yeah, thanks very much, and thanks for the report and what we see in front of us. I guess I'd say 3 things really at this stage. One is around, and James Williams often in his annual letters and such like, which I think is the next agenda item, it's the recognition that actually health, the way to tackle poor health or health inequalities is nothing to do with health. Actually, it's all the other bits of the system. And I think one of the examples we've talked about in various places over the last couple of months, of course, is something as simple as housing not having damp or mould in it. There's a kind of passing reference to that in this report. So I think that's a great starting point. I guess one of the things I would want to see, of course, our priorities around this table is looking after the 285,000 residents of Medway. But if that can help the other 1.6 million residents of Kent and vice versa, that's a great thing too. And I think this gives us the ability to do that. And I wonder whether there's some great examples here of stuff already happening, and whether that collective information sharing, which I'm sure was happening informally anyway, but whether this system, the ICS, actually puts in place that kind of more required ability to share that best practice, make sure that we're doing good things, because actually Chatham Central probably has more in common with wards in Thanet or Sheppey than it does with Hempstead and Wigmore, for example. And actually, if we can, and similarly, places like the Peninsula as well. So it's not just about deprivation. There are rural areas, for example, in Medway, and there are rural areas elsewhere in Kent. So trying to find that best practice and what works for specific communities, because there can't be a one-size-fits-all. That's not how these things work, as we all know. So just some further kind of recognition of that, I think, is going to be critical. And I guess really part of the challenge in this, and this is again why the Health and Wellbeing Board, I've always been an advocate, it's a good thing, is about trying to make the system work for the people. People don't care if they're being looked after by the NHS or by the council or by a voluntary sector charity. They care that their mum or dad is getting care, and that's it. And actually, if the process changes, so if they go from being in hospital to somewhere to recuperate to home, that needs to work for them. And actually, it's about making sure that the system, all parts of the system, are recognising that. And the telling your story once, I think we've talked about that for a long time. We've got better at that. There's still room for improvement. And this could be a key driver to getting to that point where finally you don't have to tell the council and your housing provider and your GP and your other medical specialist 4 times. You can tell them once, and the system will make sure that the other 3 people you haven't told also know those key facts. So look, this is principally a good thing, and let's see how this rolls out as we move forward. But yeah, frankly, it's got to work because the challenges are too great otherwise. Thank you.
Would you like to come back on that at all, David, please?
Really, just to say, yeah, I agree. Yes, absolutely right.
Okay, fine. Thank you. Thank you very. Oh, sorry. Yes, Andrew, please.
It might be out of order for me to raise an issue, but I will just make this point, and I have made it on numerous occasions, is that there is on page 18 safeguarding and looked after children mentioned within the strategy. There's no mention of safeguarding adults at all, and I think that is going to be addressed. I've raised it as often as I can. I think it's really important, but I just wanted to make that point to actually say that I think that should be on there as equally as safeguarding children is.
Thank you, Andrew. It is interesting that it takes somebody at a distance from what we're doing to actually pick it up and bring it to our attention. And yeah. Thank you. Yes, you happy with the comment that was made there, David, or would you like to respond?
Well, just to say that yes, we recognise that it is an omission, and it will be addressed in the update.
Okay. Well, I'm going to turn to our Vice Chairman to conclude this, but what I would say is thank you, David, for the report. Very informative, and I think the way it's been broken down into each of the sections gives us an absolute, very clear idea of what is needed. I must say, though, that the one item that did catch my eye was part of the introduction, when it said Kent and Medway is an attractive place for so many who choose to make their lives here, etc., etc. It then goes on to mention green spaces, known as the Garden of England. It is the home of some of the most affluent areas of England. Nevertheless, it is home to some of the most socially deprived areas of England. But we call ourselves the Garden of England. But it's interesting that government is quite happy to see us be part of helping to build on the Garden of England, and our green spaces disappearing. So, Howard, over to you, please.
Thank you. I move that the board notes and supports the interim integrated care strategy and asks for particular emphasis to be placed on looked after children in the discussions following the report. Preceding the final report, sorry. Okay.
And add the safeguarding adults. Yeah, okay. Thank you. Are we all agreed, please? Thank you. Right, we now move on to item number 8, reducing hypertension in Medway, the annual report of the Director on Public Health 2021-22. And in fact, it will be James Williams, our Director of Public Health, who will introduce this item, please. Thank you.
Chair, thank you. Members, the context of the annual report, I think, is well woven. It's my attempt to look at the issues that I believe are impacting on our population and try and set out some recommendations. Actually, the debate that we've had today all linked to this place. I mean, the context around safeguarding adults, as Andrew said out there, the vulnerable folk. When we start to talk about their health and their well-being, it's how can we actually shine a light in those particular areas in order for us to then come up with solutions to address problems. Reflecting on last year's report, very briefly, I think if anyone listened to the news this morning around people who unfortunately are not able to access online services, have to spend £16 a week or more per week on their shopping. My last report, as I recall, was on digital divide, the digital exclusion challenges. The link to this report is quite stark because it is the similar challenge. We've got people within our population, unfortunately, who, for a whole variety of reasons, may not be able to manage and identify whether they have got one of the challenges of the 21st century, which is hypertension. We call it the hidden killer, and it's silent, and then sometimes, unless it's genetic and it's within your family, the first time that people will know that they've got a problem is, unfortunately, when they're either in the hospital or perhaps, unfortunately, somewhere else, because the challenge for us is hypertension just sneaks upon us. 1 in 4 adults, unfortunately, are affected by high blood pressure. 13.5 million people across England, a significant number. Within Medway, 1 in 5 adults, and that's 45,000 people. Unfortunately, we've got nearly 28,000 people who may well be hypertensive, have high blood pressure, but do not know that. So our challenge, as set out in my report, is to do a number of 3 things. First, it's to try to prevent people getting hypertension. And I say this in a very kind way. There are things that we can all do to improve or reduce the risk. 1, look after ourselves more effectively, so be active. Watch the types of food that we eat, so we reduce the fatty foods, reduce the salt content, and alcohol, of course, alcohol in moderation. And I know there are many evidences out there that say drinking a bit of red wine now and again might not be too harmful for you, and I'm not going to dispute that fact. But I think drinking to excess has been shown to increase the likelihood of hypertension. Be more physically active. And that means not, running marathons and things like that, but just doing more. Our Medway Can programme is a perfect example. We've gone around the world. Remember I sat here a few months ago saying we're going around the world, and we have now completed it, and we're going around again. So 24,901 miles. The Medway population has done it. And I will say that we've been driven quite strongly by our young people, as well as older people. And people are doing lots of other things, and we're trying to go around the world again, if I might. And I know, Councillor Potter, we want to do our own mile, but that's right. When we move back, though, to some of the practical things that we can do, the identification, I mentioned the 28,000. So we've got a programme called the NHS Health Check Programme. Members will be pleased to note that we are now the 2nd highest performing local authority in the South East for identifying people, engaging with them over a 5-year period, people aged 40 to 74-year-olds, and that was done in this quarter, a fantastic achievement. And I would like to commend, if I can, through you, Chair, the team, my team that have been doing that, and in particular Kate Bell, Georgina Crossman and Scott Elliott, who leads up that work, but also the primary care teams, because this is a joint endeavour. It's not just my own public health folk, it's actually the community, our community services. We've just gone out now to a pilot with our pharmacists. We've got 7 pharmacists who are working out in our rural areas and other areas where people might have a bit of a challenge potentially, engaging and getting a health check. So providing that kind of support is ideal. The final points, I think, before I open it up to questions, is just the realisation that once people do have hypertension, then we've got to engage and ensure that they maintain their treatment. And I'm saying that in a kind way. Because once you're identified, you may well have to take medication. It's sometimes quite challenging for people to do that, but it's the best thing for them. And if they're concerned, they have got ample opportunities to engage with health professionals about how best they can be managed. But it is important, once people do have high blood pressure, to actually maintain themselves, take the medication, and do the other things that will help to reduce the challenge. So in summary, Chair, I think I'll close there with the challenge to all of us. Do we all know our numbers? Do we know our blood pressure? I know what mine is. I'm not expecting people in this room to disclose, but that gives me an opportunity for myself, because there are, unfortunately, historically, in my family, I'll say my mother had high blood pressure, so I'm minded. I've got to keep an eye on my own numbers, and I do that not to, do anything else other than to prevent things, to understand where I am with my risk, and then I can take action to address that. So with that, I'll close and open up for any questions.
Thank you, James. Vince, please.
Yeah, thank you very much, James, for your excellent report. And it follows on, I think, from last year's. So, taking a reflection back on Marmot 10 years on, and then saying, actually, what does Marmot mean in practical terms for one of the biggest issues, if not the biggest issue? So I think the subject is right. I actually think it's one of the best designed reports I've ever seen. It's clear, it's colourful, it's got pictures, it's got faces that people who will be reading this will recognise. Those things are really important if you want engagement on one of those issues which can sometimes be really tricky. Men in particular are pretty rubbish at being between the age of 40 and 74 and doing all the things they're supposed to do. So I think anything that can encourage, and I think back to, I think it was before your time, we had a really good stop smoking campaign in Medway, which had faces of people from Medway saying, actually, yeah, I've been to the place in Military Road or wherever it is, spoke to my GP, and that's worked. So I think those kind of local peers is a really powerful tool. So having some of those professionals in there, pharmacists and others, I think that's a really powerful thing to do. I guess one of the challenges, and you made mention of this, is that because we are in challenging times, the cost of living crisis is a real and genuine thing. And there will be families, and I don't say this in a dramatic way, where £10 for their prescription, because they don't quite qualify for free prescriptions, is a couple of days' worth of electric, or half a week's shop, or whatever it might be. So I am fearful that actually people will be taking not heating and eating, which is what we talk about so often, but it'll be some of those other choices which actually could be more life-threatening. And it's around, perhaps if there are schemes, and we've talked about the Household Support Fund and other bits like that, if there are schemes to say, actually, if you have an underlying medical condition, and hypertension is certainly one of those, is there ways that we can get some additional support to some people? Because that's got to be part of the key with this. In this short term, when times are really tough, is there a way we can say, actually, almost the equivalent, the medical equivalent of a food bank almost? Because that way, we've got to make sure, because frankly, I'd rather be spending £10 of taxpayers' money here than a 5 or 6 figure sum because someone's been found on the floor, taken to Medway Maritime, and is in there for a number of days. That's, even if you take compassion out of it, from a kind of cash point of view, there's a reason to do that. So I wonder if there's been any discussions around that locally, or if there are other examples elsewhere in the country, because for me, it is those people who fall into the gaps. They're not perhaps those who have got the qualifications to receive free medication, and say something like this, if you're on a couple of tablets a day, that's going to be potentially £20 or £30 every month. That's a chunk of cash. But overall, a great report, spot on, and I hope people who are watching this today, I hope people who aren't watching this today, have a look at this, and actually it's shared around through our social media, some of the key messages. That's really important. It's an accessible, easy to read, powerful report, so thank you, James.
Thank you. Did you want to come in on this, Leanne? In which case, James, would you pick this up, and then Leanne, if you'd like to contribute also. Thank you.
Thanks, Sharon. And Councillor Maple, thanks for your kind words. The context around this issue is so important for us that we have to try, and it goes back to the point that we've just had around the integrated care strategy. This is where we can innovate and get the broader impact from doing things together. And what I can say with Vincent being in the room, we've been able to work with our integrated care system and the ISS to get additional resources to do that outreach work, to mitigate against some of the issues that you've described. I think a few members were down at the Pembroke the other week where we, for our Medway Can programme, we are providing resources to those types of people that you've discussed who might well be challenged in relation to them being able to afford certain elements of it. And I definitely take your point about the household support fund and how we can actually utilise that resource to target best some people who may well be more challenged. That's a great point that you make, and clearly we will think through how we can best utilise that.
Thank you, Chair. One of the things that I've been considering around this report, and I agree it's a very good report. Yes, James, I do know what my numbers are. In fact, I was taking my blood pressure last Friday when I got the call from Ofsted telling me that they were coming to see us, and it went through the roof. So I didn't count that one. But what I'm really interested in is trying to get the taking of blood pressure aligned to the health and well-being agenda rather than the doctor and the hospital. And so I'm wondering, James, what your views are. I mean, I just use a chemist, a pharmacy bought machine. You know, are these machines available in our food banks? Are they available in our community settings so that we can start to get people to think differently? Because what I feel we need to do is have a community that's really focused in on health and well-being, and this is an absolutely key issue around health and well-being, but it is not linked to doctor, hospital, and the medical. So can you comment on that for me, please?
Thanks, through you, Chair. And great points, Leanne, and clearly you've identified another one of the challenges, which is how do we all manage our well-being and keep our stress. So it's getting that balance. So I've got a few stats actually, make some great points. The whole point about managing your blood pressure is that these devices these days, you don't need to go to a doctor anymore with a stethoscope, you know, to put on those scuffs on an old big monitor. I think I got that out, the old mercury things. I did used to be able to use one once. But you can just wrap one around your wrist, push a button. It's got instructions on there. It'll bleep it. It'll take your blood pressure. Some of them will even do your pulse oxygen levels and all the rest of that malarkey. So it is to normalise this as part of your general looking after yourself. Our teams, we do, and there are programmes actually working with our primary care networks where we are giving blood pressure monitors out to people into the community. Our outreach work, we go on to the high streets. So we're going into our shopping centres. That's where we're the Pentagon. We'll go up to the Rainham, up at the top there, Hempstead Valley. I nearly forgot where it was. Over into Strood. And we are trying to normalise the way in which we look at these issues, because we've just had the debate, haven't we, about people who potentially have got cognitive impairment, mental well-being. To get them to go to a doctor or to go is quite difficult. So we've got these other tools, work with our community and voluntary sector, who can then advocate. If I take the older person's agenda, and I'm nearly there, aren't I? We've got welfare-controlled sites where you might have a warden and somebody like that who can look at, but everybody can have their own little machine, they can take it, they can self-report. The last time I took my blood pressure, which is about, well, it was this week, but the last time my GP requested it was 2 weeks ago, and they just said text in your recordings. So that whole thing around being independent and not having to actually go into a surgery is where we need to get to. So your points are really well made. I think we all need to start thinking about how we can sell that message to other people, because that's what it's about. It's encouraging folk to say, and actually, when you then need it, and if your blood pressure is over 100, 140 over 90, then you need to go and talk to somebody, and that person can support you there and then. And everybody else, you know, you can keep on top of that, which means that our primary care teams, our clinicians have got the space to really deal with those people who need our support when they actually require it. So great points that are made. We do need to demedicalise this issue. And remember, as we say, 80% of the issues that arise to cause us to have a health problem about other things. And I'll do a quick pun, Chair, because I know that we need to move on with the agenda. But Medway Council has been shortlisted for the Wellbeing Consultancy of the Year. And that's the work that we do within our workplace programme. So our workplace teams are going out and about into general business and commerce. We've now been shortlisted for that. And again, it's pushing the whole normalisation of looking after yourself within settings. But great points, Leanne, and thank you. We will take those on board.
James. Martin, please.
Yeah, thank you, Chair. Well, I have a question, a comment, and a challenge for you, James. So I shall start with the question, and that's about data. So I can see that Rainham North, my ward, tops the charts for hypertension. We have, not to do with their councillor, we have discussed this in another forum, and although we would sort of have a demographic profile where you would expect those higher rates of hypertension, what you also said is actually there's good quality of data for Rainham North and for, generally speaking, those Rainham and Eastern Medway wards, more affluent parts of Medway. And actually there's likely to be a lot of unknowns in those other parts of Medway where you haven't got those people coming forward and getting tested and being part of these programmes. So what more can we do around the quality of the data there? So that's the question. In terms of the comment, I totally agree that it's health and wellbeing it's about the whole community, not just about the medical practitioners, and that was exemplified today, James, with you and your team attending the Medway Education Partnership. We had good engagement with head teachers and education leaders across Medway, across a variety of health and wellbeing matters. But as you all know, one of my concerns about medical provision in Rainham at the moment is that we've seen 2 surgeries move out of the Healthy Living Centre, another surgery, which is my surgery, essentially operating from another practice in Medway with a hub model. And I'm concerned that when local people need to access a GP in the locality, because we're not losing this resource from Medway, but it's not located in the Healthy Living Centre in that purpose-built facility, by not having it there, you've got that barrier to access. And actually when local people need to go and see a GP, when it's at that level, it's more challenging for them. There is that barrier there. So I'll leave that comment there because I'm pursuing that in other forums, but I think it should be mentioned. And then finally with the challenge, yes, we should have that run, that race, whatever you want to call it, that Medway, our own little Medway mile. We must do that before I disappear after May. Although I'm not disappearing from Medway, but from the council. Thank you.
Do you want to take the other questions first?
Yes, sure.
Yeah. Before answering your points, Martin, we'll go on to Adrian, then Stuart, and then James will come back on all of the points, if we may, please.
Well, I certainly agree with the comments. This is a very well-written report. In fact, I think they're getting better and more accessible year after year, which is great. But also, it's not just about producing reports, is it? It's about what the actions you take. And James, you mentioned the Medway Can event at the Pentagon, which my wife and I went along to. I really do think we need to do more of that sort of thing, because looking at the people around me, you know, there was a lot of engagement there. And I thought the idea of cooking or giving a demonstration of tasty, nutritious, cheap food was absolutely brilliant. Pat and I were offered one of the takeaway bags, but we said no, we could well afford it. But Pat did take the little pack of recipes away, and a couple of nights ago we had one of them for dinner, and a very nice meal it was too, I've got to say. So if Pat's listening to that, perhaps I'll get a nice one tonight as well. But there is a point, and Vince hinted on this about, you know, people are struggling, and I think there's a definite issue that we need to give people a little bit of advice and help, because it is possible to produce good quality nutritious meals quite economically, and I think we need to do more of that. So that demonstration was brilliant, and well, and we need to do more of that. You know, we've got lots of, you know, libraries, hubs, centres all dotted all over Medway, out in the peninsula, and, you know, in the urban areas that we could perhaps roll this out to. And when it comes to blood pressure testing, well, we own the Pentagon. It's ours. It's going to be ours for, you know, forever. Is there any way we could have a sort of permanent or semi-permanent facility there, or get somebody there on a, you know, once a week or something with a little team, you know, and just encourage people to sit down, have their blood pressure taken, and get a piece of advice? You know, it's our facility. I can certainly say there's good, you know, there's going to be no charge for it. You know, in fact, you know, wearing my sort of property hat, it's been absolutely great. Some of the child-friendly city events and events we put on in the centre of Chatham have actually increased the footfall. So it's a win-win for us as a council. You know, not only are we benefiting people, but we're actually creating that footfall, which makes the Pentagon Centre, indeed the whole town centre, more viable. So I'd certainly be up if you're willing for the challenge. I can make sure the Pentagon provides the space. If you can provide the team that are willing to put these things on and have, you know, regular testing, let's go for it, because it's a win-win for all of us, isn't it?
Well, good to see you've got some budget available to support this, Councillor Golding. Well, that's right. Yeah. Stuart, please.
Oh, yeah, thank you. I don't know my numbers because I don't understand them, but my doctor says they're all in the green area, so I'm happy with that, whatever they might be. Just a comment, and then a couple of very simple questions. A comment, I suppose as councillors we shouldn't have favourites, but I think the Public Health Department is one of my favourites, because, and the reason I say that is because I do know that it's in the DNA of your organisation that all of these factors are communicated, that the team are enthused about it, and they're out there all the time, because I'm on the receiving end of it quite often when they want to send out this to that person or somebody else, and, you know, can I put it on my mailing list, and hopefully to lots of other people as well. That's a great sign, because all of these things that you're doing are getting out through every creative way you can think of. So that's just to encourage, please keep that up, because I think that is at the heart of what we do, and we do it really well, is to keep every opportunity to talk about these health messages, which are, some of them are quite complicated. This report, I agree, it's a fantastic report, but it's designed for really people who are professional, interested and involved in it. So my question is, who is seeing this report? You may have covered it, please remind me where this report is going. And is there some kind of simplified version for folk just to pick up, whether it's on our website or somewhere else, of some of the key points that are being made in it? Thank you.
Thanks, Chair. So, Councillor Potter, in relation to the data quality, so we did go through that, and that's one of the good aspects, where you've got high numbers of good data quality. So the context around your patch, as you mentioned before, what we're interested in is trying to find, because we can do checks against your practice population or the actual population in a practice, and look at what the expected number of people should be in that practice, and how many of those people actually do have their blood pressure recorded. And that's how we work collaboratively across with our NHS colleagues, as well as through my public health intelligence teams. So the work on improving data quality goes on, and what we need to do, though, is to find all those people who potentially should be registered in certain areas, and aren't. And that's one of the tricks that we do is do outreach, and I've got some figures actually. Back to Councillor Gulvin's points. We already do that, to be fair. We've got a roving bus that goes around, and they're often in the Pentagon. So that work's happening at the moment, and obviously we do work in partnership with our NHS colleagues because it does go around the place. But, you know, we did 1,300 BP checks down in and around our high streets just over the last few months. So the context of doing that work is ongoing. But when we do those checks, the data that we find goes into the GP record because our system enables us to do that. I think one of the challenges, though, is that regardless of what we do, we've got to do more. And all I would say, I'd go back to the points that Councillor Tranter's raised, is that we just need to keep spreading the word. There's a lot of people out there. I've already said that we're high performing in relation to the work that we do, but I want to do more. There are lots of scope for us, whether you know, it's down in, I was going to say down the pub, but people do down the pub. Do they talk about the blood pressure? Probably not. But I'd like to change that conversation. That was Leanne's point around normalising these kinds of discussions. You know, we talked previously, didn't we, about men of a certain age. Well, it is men of a certain age, and we do need to address that problem. But it's also then breaking it down into specific groups, because we also know that there are certain groups when we're looking at, say, obesity and things like this for risk factors, where it's more prevalent in some of our ethnic minority communities. So we've got to break some of those barriers down. So in relation to those points that you raised, challenge is accepted. We need to do more. We are trying to do more. Some of the innovation that will come on board in relation to our integrated care system work will help us with that. It will help us with our data and analysis. The fact that we are a health determinants research collaborative centre, only one at this moment in time in the South East, also helps us, and David, as our director of that, clearly will be looking at what are the tools that we can use to improve people's ability to say, and actually, by the way, I do want to go down and get my BP checked. But bearing in mind that we've opened up for the first time the ability for people to just go into pharmacists across the piece, means that you don't need to go to your GP. And as I've already mentioned, the whole point about the electronic systems and doing that digitally, I've just gone in with a text message, sent my readings into my practice, and it's recorded. So there are different ways. We've got to try to find, you know, the right solutions. I don't know what they all are. That's why collectively we need to keep working on that. But I do know we need to do more in our disadvantaged communities. We've got to do things differently. And the points that Councillor Gulvin's raised about doing things in different spaces is the way in which we'll improve that data collection, but also the quality of it as well. The points that were raised around the programmes and the shop, I think I've covered those off, to be fair, because that's just BAU for us. We business as usual. We do go out, they do roaming things, and that is ongoing. And of course, we've got our shop on the high street that is literally across the way. They do outreach sometimes into the Pentagon, and clearly, hopefully in the future, when we get those other developments in there, then that will just be a common thing. They'll go down there and do what needs to be done. I think the final points around the links, I think, Councillor Tranter, to how do we keep that momentum going and how do we ensure that our communities are engaged? It's through members and board members. This is the forum. You know, this is the Health Wellbeing Board. We are all part of that journey, and we've got to just recognise that it's not me, it's not you, it's all of us trying to do that together. So we will keep trying to push forward. You mentioned who the audience is. I'm pushing out to anybody that I can. The annual report hopefully is accessible. We'll do summarised versions, of course, we do that. But when I put together presentations, we try to gear it so that we can talk to different audiences and cut that cough accordingly to whoever it is that we're trying to communicate with. So your point's really well made, but I do try and make sure that we can just engage with whoever it is. One of my messages, remembering this, is that there are people who have got high blood pressure and they need to understand the benefits of doing the things that their health professionals and others are guiding us through, and that's a slightly different message to the people who are sat there thinking that they haven't got a problem, but maybe have. So I've got to try to make sure that I communicate with them in slightly different ways. And any tool that I have got, which is through members and other folk, I'm more than happy to jump on any bandwagon to use that. So that would be my message. But your points around making it accessible, noted, and we do try and tailor it, of course, with little videos and clips like that to get those messages out there.
Well, thank you, James, and thank you, members, for your contribution on this item. So, Andrew, you'd like to come in, please? Yeah.
a charity in Medway that actually is exactly the example that James is talking about. 2 years ago, I met with Paramajot Kaur, who works at Medway, who wanted to set up an organisation to support older Southeast Asian families and older people. That she has done, and she's based in Gillingham. And I'm just looking at her website. It's amazing what she does. They do health and well-being consistently, social events, health and well-being checks where they have people come in and talk about health and well-being. They do the hypertension checking. They provide information on diabetes. I'm going to go in and talk about safeguarding. They do walk and talk, so they go out on a regular basis and walk around, usually down towards Gillingham. Exercise classes, they're currently just started a set of Bollywood classes, which you do sitting down, which is even better. And so it is within your community, I think, something that's growing, and they are growing in terms of their numbers and attendance, which is dealing with these health issues within their own community and identifying how they best deal with those. And if you're not aware of Sahara, please have a look at their website. It's a very inspiring story of how one person has brought together such a great community initiative. Thanks.
And of course, we know all about them because they are part of our Better Medway network, and we actually sponsor and support them. But again, thank you for flagging that one, Andrew. And actually, while I'm there, I might as well do a flag to David Whiting, because one of the issues that we do have is that we've done our Picture of Medway survey. So we have got really granular data about what our challenges are. And David, I don't know whether you just want to briefly mention the link back to the additional information now that we've been able to glean from that report.
Thanks, yes. So I think I have talked about the health and wellbeing survey in previous meetings. I think the last time I came to talk to the board about it was when we just got the initial data, and I looked at the age distribution by deprivation, just to which provided reassurance that it's a good representative sample of Medway. So now the Public Health Intelligence team has done the first set of analysis of the data, and it's available on the council website under the JSNA section. I'll ask if we can send the link out after the meeting. And this provides some really nice detailed data about health and well-being across different parts of Medway. And it's particularly important for us for being able to look within Medway. So there are a number of important measures that we have. For example, smoking prevalence that we get from national surveys that provide the prevalence per local authority. So for a number of years, we've had a good idea of the prevalence of smoking in Medway, but we haven't known about the differences in prevalence of smoking across different parts of Medway. So now with the Health and Wellbeing Survey, we do know the prevalence in one part of Medway compared to another. So it's a nice looking set of slides. I thoroughly recommend having a look at it.
Well, thank you everyone for your contributions to that, and thank you, James, for the report. Before I hand over to Councillor Dar, I would just like to say that I think we're extremely lucky here in Medway, as has already been pointed out. Our public health team is second to none, and the work that they do, their involvement in the community is exemplary. It really is a group of people reaching out to every corner of our community, and in fact, a date has been put in the diary, which I can't remember what the date is, but we're shortly to be supporting once again and doing joint working with the Royal Engineers just round the corner from where we are today. And we spend the day with the Royal Engineers working in partnership. Our public health team put together all of the necessary stands and stalls that looks at stop smoking, oral health, healthy eating, healthy living, you name it, it's all there. Every stand there is there for people to see, and for young suppers and indeed senior officers also to have a look to see what's going on. That's our contribution. And then on the other side, you have the Royal Engineers themselves together with their physical fitness group. They provide all of the activities. And it is, in fact, a day that it sends your mind blowing, believe me. And it's quite normal to have something like 12 to 1,400 people. That is army personnel, civilian employees of the army, together with the families. It's expanded from just being the army personnel into the civil members of staff, and now into the families, and they all come together, and during the course of a day, as I say, 12 to 1,400 people will in fact be passing through the gates and benefiting from some working within the community. So that's just one example of where our public health team has been taking us, and where it will continue to do so. So there's lots going on. Thanks, James, for the report. I'll now hand over to Howard, if I may, please.
I move that we note the annual public health report for 21-22 and congratulate the officers on the progress that has been made with this particular topic. It's been splendid.
Are we agreed? Thank you very much. Now moving on to item 9, which I believe is the last item on the agenda, which is the work programme. I'll pass across now to Stephanie on our Democratic Service team to introduce this item, please.
I take the report as read, but just to make a point regarding the April meeting, we did have a number of items that were scheduled, but due to the politically restricted period, we've had a discussion in the pre-agenda meeting, and it was suggested that we use this opportunity for a development session that will be delivered with the assistance of colleagues from the LGA to help the board to reaffirm the collective work and roles within the board, and to look at how the different boards interact. The first section of the meeting will be business as usual, because we have a report from Vincent's side, which is the NHS Joint 5-Year Forward Plan. That needs to be taken because of their submission deadlines. After that, we'll then go into the development session. I don't know if James or David wanted to say anything more about that.
Thanks, Stephanie. And just board members, because if you think about the discussion that we've had today, and in particular the papers, and specifically the one around the integrated care strategy, what we're trying to do is to use that next session to give us the opportunity to sit down as a board, to start to unpick some of the challenges that we will need to face to ensure that we can deliver our priorities into that space and vice versa, and give us a better understanding as to where we're going now, because the 5-year forward plan, and we won't talk to it now, of course, but it's quite an important piece of work that will align to how we set our priorities for our joint local health and wellbeing strategy and also the integrated care strategy. So it's just an opportunity for us to take stock as a board, do some development work with some peer support from the LGA, look at our practice, and then be able to fine-tune ourselves moving forward. And that's basically it.
Thank you. Can I just ask, will all of the board members and our partners, will they all be invited to contribute on that day? Well, thank you very much. Vince.
Yeah, thanks very much. That sounds really good. I mean, any meeting in April is quite restricted. It can only have effectively low-level or urgent matters because of the nature of being in the pre-election period. So I think that's a good use of time, and any peer support from the LGA is always a good thing. So I wholeheartedly support that and look forward to that. It may be helpful because, of course, there may be a number of new members on the Health and Wellbeing Board next year. So if those resources can be, well, not next year, next municipal year, not least because colleagues like Councillor Potter will not be here. He'll be enjoying tuning in, I think. He'll be watching on from afar. or running around the world, apparently. That sounds a good thing. So that would be helpful if those resources are available to pass on to whoever is lucky enough to sit in these seats moving forward. My second point really is around attendance, and in particular of KMPT. This may have come up at the start of the meeting. If you think about some of the issues we've raised throughout today, the input of a KMPT colleague would have been valuable, whether it's safeguarding, whether it's the integrated care system, whether it's actually the impact on your mental health of being told you have hypertension. On all of those examples, having their voice at this table would be really helpful. I may be inaccurate in this, but I believe it's now 2 years since they've been around this table. It's a long, long time. And I wondered, in a supportive way, not in a kind of aggressive or angry way, but a kind of really urging them to be here, because actually their input is valuable. There are other colleagues missing today, and of course people give apologies. We've all given apologies to meetings, but it's been a very, very long time since we've had a KMPT representative here, and their input is vital. So I wonder perhaps whether the chair would be able to write on behalf of the whole board to say, we value what they do, they're an important part of our community, they've got a clearly important role, not least half a mile down the road in Gillingham, they are delivering for our residents, but it'd be great to have them here. And I say that not in a kind of accusatory way, a finger-pointing way. They need to be in the room. They really do need to be in the room. Thank you.
Thank you, Vince. I'd just like to point out that this afternoon we have Vincent Badu, who is here this afternoon. He, in fact, he's here to make sure that we are actually quorate to have our Health and Wellbeing Board. So he's been double hatting, really, because Vincent is also deputises for KMPT on many occasions. Am I correct in what I'm saying, Vincent?
Thank you, Chair. So just to add some clarity. So NHS Kent and Medway, as the Integrated Care Board, has a responsibility for leadership of the NHS across Kent and Medway. So although I absolutely acknowledge your point about having individual providers represented on this board, that role is also facilitated by Paul or myself being here as Paul's deputy. So I think if there are specific agenda items where it'd be useful to have a presence here, I'm happy to take some responsibility for talking to the senior team at KMPT. Declare an interest, as you know, I used to be one of the senior team at KMPT, so I'm happy to talk to colleagues there, and also I will take back any issues or give input where I can to the discussion.
Thank you. I would, in fact, endorse what Vince has actually said, because I think that practically every item that we've discussed this afternoon, and the fact is it's practically every item that we ever go through, meeting after meeting, there is invariably an item on there relative to mental health, which is KMPT area. And sometimes we have to second best guess what the answers might be. And this is, in fact, for your information, Vince, this is an issue that I have raised with our Chief Executive, and indeed with Leanne and James, to make sure that we do get that message out to all of our partners, that they expect us to be partners in what they're doing, and equally our expectation is that all of these community groups be partners with us as well. We can't do it on our own, and equally they can't do it on their own. So it is important that we all come together and we share the information and we work together. And I fully support what you're saying.
I'd welcome that informal conversation. Perhaps that's a starting point before a more formal, because writing a letter does become quite formal. And I am doing this from a kind of place of not finger pointing, not accusing them, just saying for exactly that. For every item today, there is a mental health and well-being element to that. The other thing I would say is, I think I noted formally that at the moment, we have a formal vacancy from Medway Health Watch. Of course, they are one of the statutory individuals. So again, not for here necessarily, but recognising that if that space hasn't been filled, if it's going to be filled soon, that would be great. Because again, in a similar vein, the voice of the service user, patient, family member being around this table has always added value. We've had some great Health Watch representatives, and of course people move on and do other things. So if we know when that vacancy is being filled, that would be great. Thank you.
Just to let you know that I am working on that. I have been in contact with them in the past week, and they are trying to identify people for us on the board.
That's great to hear. And again, I think I certainly, I'm sure it has happened already, but I'd formally want to put on record my thanks to Maggie for her input while she was around this table, and Pat previously as well, of course. So in this municipal cycle, thank you.
Thanks, Chev. Just very briefly, because I'm minded of time set. In terms of the Health Watch rep, I'm pretty sure, because they were in a meeting yesterday, that person has now been identified. I think it'll be for Health Watch to nominate that person, but we did meet yesterday, so I think that has been resolved. And then just in that general term around the membership and the work, I think that's an ideal discussion that we've just had about the ways of working that we can pick up in April, because I think Vincent's given us some assurance, which is actually if there is an issue, then the appropriate person will be identified to come in at that appropriate time, but clearly we just need to go through that process, don't we, in April, to understand how best we can configure all of the board members to make sure that we can deliver against, you know, the priorities that we at a local level in any event are trying to set out, and not least that interface with the health and care partnership, because you've got to provide a collaborative in there where clearly our mental health colleagues are linked in, so we've just got to make sure that we dovetail that.
Thank you. May I turn to you now, Howard, please, to
certainly,
recommendations?
it's quite simply, I think that the work, the schedule of work that's been put forward is approved.
Okay. Are we all agreed? Great. Thank you all very much. Well, thank you very much for your time this afternoon, and for all of you for your contributions. All very much appreciated. Wish you well and see you at the next meeting. Thank you.